Scoliosis is a curvature of the spine when you're looking at a patient's back. It's really a three-dimensional rotation of the spine on the central axis of the body.
A lot of the kids we see are at that growth spurt. You know, they're 10, 12, 14 years old when their scoliosis is first identified. They have horrible body mechanics, really awkward movement patterns, which kind of feeds into their scoliosis.
Scoliosis is diagnosed by clinical examination as well as by x-ray or imaging.
So Dr. Albert will probably get some x-rays today. So we work a lot on identifying where their curve is, giving them very, very specific exercises to help correct their curve and help them throughout the day assume a better posture in the hopes that that will prevent their curve from progressing. Are you carrying your backpack yet? Or we can't reverse the curve, but we do feel like we're slowing it down and also giving them the best outcome they can if they do have to have surgery.
We have treatment options that range from just observation and therapy techniques to bracing, and we also have different surgical techniques.
Each one of our spine surgeons looks at the patient individually, and they look at their curve, they look at the progression of their curve.
The surgical options vary widely from very young patients where we might consider doing what's called a metacast, which is a full body cast that helps control the rotation of the spine.
The most common surgical technique that we do at our center is called a posterior spinal fusion. We do surgery with rods and screws and bands to do a three-dimensional correction of the spine.
It's kind of specific to each patient, so it's not a one-fits-all type of program at all. Every curve is different, every kid is different.
We also offer non-fusion techniques for surgery, and we are one of the first centers in our country that are doing this technique called ApiFix. It's a special device that does not require us to do a fusion of the spine.
I think the fact that we're doing the ApiFix procedure is pretty revolutionary.
This device can grow along with kids that are growing, but kids that are done growing can also be used to correct the curve and maintain the curve pattern.
We've seen really great results with that. The patients also have much less pain, and so it's rewarding to see that they're getting treated early and they're recovering from the surgery a lot faster.
The kids are only in the hospital overnight. They get out of bed the day of surgery and we start physical therapy. Our average length of stay is 1 day. They're off all of their narcotic medication on average of 3 days. They miss approximately 2 weeks of school and are back to doing the activities they like to do between 4 and 8 weeks.
What's special about Dayton Children's and their scoliosis program is that our pain management is involved in every step of the way.
We have seen a dramatic decrease in the length of stays, but we've also seen patients who are far more comfortable, able to do their physical therapy much better, and who afterwards do not nearly have as much pain as they've had in the past.
We make sure that these kiddos have a lot of what they need to heal so that they can do the therapy that they need to do to heal.
No chickens. There you go. Perfect.
So I think education is really important to set the patients at ease and the families at ease and have them really informed.
I work with all the patients from start to finish. I get to build these relationships with the families, and I get to be that person that they get to come to.
We've got a great team here, we really do, of people who love what they do and are very good at it. One, good, and then stretch.
We have such an amazing team of people here, all dedicated to the health of your child's spine, and we truly represent some of the best world-class care.
Our orthopedic and anesthesia and pain team work very well together, and that provides a consistency that's really important.
It's just really rewarding to help see them through that process.
And then get as tall as you can there, nice and long. Yeah, it was beautiful.
I think we're just top of the line, and I really think that it's a great place to bring your child to have spine surgery.